Hi, I'm Liz Hillen, prosthetist orthotist with SPS. Welcome to the Clinical Minute. In this series, I'm joined by Greg Steward, prosthetist orthotist from Elevate Dynamics. Welcome, Greg.
Hey, Liz, how you doing?
I'm doing great, thank you. So let's talk about the amazing benefits and optimal clinical outcomes that we're seeing with the free flow and the glide.
So what we're talking about today is the HelixBand that's accompanied or to accommodate the free flow and the glide for both patients with pronation or medial lateral instabilities, as well as supination support for those patients that have stroke. So we're going to look at a couple of videos to see some patient outcomes with the device and without it. So first off, we have our patient, Renata. She's a 33-year-old patient who has post-stroke. And on the right side video, you can see she has that hip hiking, some circumduction, and she's landing on the lateral border of a foot.
Right.
On the left side video, you see her with the free flow and the HelixBand. And we see her have a more symmetrical gait. That knee is coming straight forward and that hip hike is reduced. And we'll watch the video again just so we can see the whole thing from start to finish. So we see that hip hiking and circumduction. And on the left, from the posterior aspect of it, we see her have that clearance and that more symmetrical step, and she's walking pretty good and a lot faster than she was without the device.
Nice, nice. If we're going to reduce the energy expenditure, that's half the battle. But yeah, that symmetrical gait improvement is phenomenal.
Absolutely. And then the next patient we have is Robert. Robert is a 42-year-old male. He was born with clubfoot, right side affected. That anterior tibialis muscle is zero trace, if anything. So we'll see him walking. As we see him walking, we see that steppage gait like we see in that deficient anterior tibialis in most patients. And we have some rollout as far as the ankle is concerned. So on the right-hand side with the device, you'll see him in our glide, our anterior device, with the HelixBand set up with supination support, pulling the foot medially, so he can have that that initial contact, and then that midfoot or that whole foot is landing on the ground during mid stance, and he has that stability throughout the gait cycle. With Robert, he does a lot of activities as far as Muay Thai is concerned and extracurriculars. When he is utilizing his device with those extracurricular activities, he actually takes his HelixBand off to be able to have more flexibility in that. So it's an interesting way. So we have the ability to take that support off if needed for different activities for the patient.
That's great. I love it. Great clinical solutions on the Elevate Dynamics AFO Glide and Free Flow with the HelixBand to really reposition that or correct the tibia and prevent that rotation. So great solutions. If you like more information on the Elevate Dynamics AFOs, the Glide and the Free Flow, as well as the HelixBand, go to spsco.com. Thank you, Greg. I appreciate this. And thank you for watching.